A 65-year-old hypertensive man develops sudden left hemiplegia and gaze deviation to the right. CT head plane at 2 hours is normal. Next best imaging to identify early ischemia. MRI brain with diffusion-weighted sequence. Time window for intravenous alteplase in acute ischemic stroke from symptom onset. NEET-PG guideline follow-up 2024. Within 4.5 hours. Dense MCA sign on non-contrast CT indicates early thrombus in which artery? M1 segment of middle cerebral artery. A 30-year-old woman has relapsing optic neuritis and paraparesis. MRI brain shows periventricular Dawson fingers. Which antibody is most specific for her likely disease? Anti-aquaporin 4 IgG is for NMOSD. But in classical MS, most specific test is oligoclonal IgG bands, CSF. Answer: CSF oligoclonal IgG bands. First-line disease-modifying injectable for relapsing remitting multiple sclerosis in Indian NLEM 2024. Interferon beta 1a, 30 micrograms IM weekly. A patient has resting tremor, cogwheel rigidity, and hypomemia. Which drug improves bradykinesia and has mortality benefit per PD trial data? Levodopa-carbidopa combination. Drug used to treat motor fluctuations wearing off in Parkinson disease by COMT inhibition? Entacapone. Substantia nigra pars compacta degeneration in Parkinson disease shows intracytoplasmic inclusions called Lewy bodies alpha-synuclein aggregates. Myasthenia gravis initial bedside test that shows transient ptosis reversal within seconds. ICE-PAC test. First-line long-term immunosuppressive agent for generalized myasthenia gravis not controlled on pyridostigmine. Oral prednisone, corticosteroids. Drug of choice for acute myasthenic crisis requiring rapid improvement, plasmapheresis, plasma exchange, or IVIG. Guillain-Barré syndrome CSF profile after first week shows albuminocytological dissociation, high protein, normal cells. Miller-Fisher variant of GBS is characterized by ophthalmoplegia, ataxia, and anaphylaxia with antibodies against GQ1b ganglioside. Status epilepticus, first-line IV drug in emergency department, lorazepam 0.1 mg per kilogram IV. Preferred second-line agent for convulsive status if benzodiazepine fails, per ILAE 2023. IV levetiracetam 60 mg kilogram, max 4,500 mg. Absence seizures in a 9-year-old child are best treated with ethosuximide. Drug that can precipitate generalized tonic-clonic seizures when given for absence epilepsy alone, carbamazepine. A unilateral throbbing headache with photophobia relieved by sleep, likely migraine. First-line acute therapy for moderate attack. Oral triptan, e.g. sumatriptan 50 mg. Prophylaxis for chronic migraine over 15 days month in a patient with hypertension, propranolol or metoprolol. 100% oxygen via non-rebreather is first-line abortive therapy for which primary headache? Cluster headache. CT shows biconvex hyperdense extraaxial collection and temporal bone fracture. Likely vessel injured, middle meningeal artery, epidural hematoma. Normal pressure hydrocephalus triad, gait disturbance, cognitive decline, and urinary incontinence. Most sensitive clinical sign of early hepatic encephalopathy? Asterixis, flapping tremor. An HIV patient presents with multiple ring-enhancing lesions in basal ganglia on MRI. Empirical treatment started? Pyrimethamine plus sulfadiazine plus leucovorin for cerebral toxoplasmosis. Subarachnoid hemorrhage confirmed on NCCT. Drug to prevent delayed cerebral vasospasm. Oral nimodipine 60 mg every 4 hours. Most common cause of spontaneous intracerebral hemorrhage in elderly hypertensives. Charcot-Bouchard aneurysm rupture, hypertensive vasculopathy. Young female presents with thunderclap headache, CT negative. Next investigation? CT angiography brain or MR angiography to rule out SAH if LP contraindicated. Critical illness polyneuropathy primarily affects which nerve fibers? Motor, sensory axons, distal limbs. Amyotrophic lateral sclerosis drug that prolongs survival by inhibiting glutamate release? Riluzole. Huntington disease inheritance pattern. Autosomal dominant, CAG trinucleotide repeat on chromosome 4. Which artery supplies Broca area, posterior inferior frontal gyrus? Superior division of left middle cerebral artery. Cerebellar lesion causes ipsilateral limb ataxia because cerebellar output fibers decussate how many times? Twice. Double-crossed pathways. Internuclear ophthalmoplegia is due to lesion in which brainstem structure? Medial longitudinal fasciculus. Increased JVP with Kussmaul sign and pericardial knock suggest constrictive pericarditis, though cardio, relevant to neurology diff. Wernicke aphasia results from infarct in which cortical area? Brodmann number. Area 22, posterior superior temporal gyrus. A 50-year-old with essential tremor gets relief after alcohol. First-line long-term pharmacologic option, propranolol. Frontotemporal dementia genetic mutation commonly involves gene on chromosome 17. Tau MAPT or progranulin, GRN, tau accepted. CSF beta amyloid decreased and tau increased in which neurodegenerative disorder? Alzheimer's disease. Speak. Prosody rate 120%. C-reactive protein high, ESR 85 mm per hour. New temporal headache in elderly with jaw claudication. Immediate therapy. High-dose prednisone to prevent visual loss. Giant cell arteritis. Prosody rate 120%. Do expect. Relative afferent pupillary defect Marcus Gunn localizes lesion to optic nerve or severe retinal disease. Stiff person syndrome is associated with antibodies against which enzyme? Glutamic acid decarboxylase, GAD65. Drug of choice for trigeminal neuralgia refractory to carbamazepine? Oxcarbazepine or baclofen? Oxcarbazepine accepted. Downward gaze palsy with sunsetting eyes in child points to tumor in which region? Pineal, Parinaud syndrome. Most common primary malignant brain tumor in adults? Glioblastoma multiforme, WHO grade 4 astrocytoma. Butterfly lesion crossing corpus callosum on MRI likely? Glioblastoma multiforme. Acetazolamide reduces CSF production and is used in which benign condition causing raised ICP? Idiopathic intracranial hypertension, pseudotumor cerebri. Myoclonic jerks on waking in adolescent with normal MRI and EEG, 4 to 6 Hz polyspike wave, syndrome, juvenile myoclonic epilepsy. Doc for juvenile myoclonic epilepsy, sodium valproate. Which antiepileptic is safest in pregnancy for generalized seizures? Lamotrigine. Cerebral malaria first-line IV drug per NVB-DCP, artesunate 2.4 mg per kilogram IV at 0-12-24 H, then daily. Most common treatable cause of dementia in India, B12 deficiency aside, hypothyroidism. Bilateral loss of vibration and proprioception with preserved pain temp suggests lesion of distal cord columns, dorsal columns. Brown-Séquard syndrome, ipsilateral UMN weakness below lesion due to damage of which tract? Lateral corticospinal tract. Syringomyelia typically causes cape-like loss of pain and temperature due to destruction of anterior white commissure. Epidural spinal abscess early management besides antibiotics, urgent surgical decompression. Most common cause of bacterial meningitis in Indian adults, Streptococcus pneumoniae. Empirical therapy for community-acquired bacterial meningitis age 18 to 50Y. Ceftriaxone plus vancomycin. Neonatal meningitis, common organism associated with maternal vaginal colonization. Group B Streptococcus, S. agalactiae. Cushing triad, hypertension, bradycardia, irregular respiration, indicates raised intracranial pressure, impending herniation. Drug used to lower ICP by reducing CSF volume following traumatic brain injury, mannitol, hyperosmolar therapy. Chiari-2 malformation is almost always associated with which spinal defect? Myelomeningocele. Subacute combined degeneration of spinal cord occurs due to deficiency of vitamin B12. Lermit sign, electric shocks on neck flexion, is classically seen in multiple sclerosis. Wrist drop with sensory loss over dorsum of hand follows fracture of which humeral part? Midshaft, radial nerve in spiral groove. Agraphia, acalcula, finger agnosia, and left-right disorientation constitute which parietal lobe syndrome? Gerstmann syndrome. In Wilson disease, neurologic symptoms improve with which chelator preferred in India? D-penicillamine. Kayser-Fleischer rings deposit copper in which corneal layer? Decimate membrane. Normal sagittal sinus thrombosis postpartum diagnosed best with which MR sequence? MR venography, TOF. Sodium valproate toxicity shows hyperammonemic encephalopathy. Antidote, L-carnitine. Prefer an anti-epileptic for focal seizure with comorbid obesity. Topiramate causes weight loss. Brain abscess, most common predisposing factor in cyanotic congenital heart disease kids. Right to left shunt causing paradoxical septic emboli. Brodmann areas 1, 2, 3 correspond to which cortex? Primary somatosensory cortex, post-central gyrus. Ontine hemorrhage often leads to pinpoint pupils due to disruption of descending sympathetic fibers. Phenytoin chronic use causes which oral adverse effect? Gingival hyperplasia. Drug-induced Parkinsonism, commonly due to which antiemetic still widely used? Metoclopramide. Hot cross bun sign on MRI pons indicates which spinocerebellar degeneration? Multiple system atrophy, cerebellar type. Creutzfeldt-Jakob disease, EEG, characteristic periodic sharp wave complexes at Hertz, 1 per second, 1 Hertz. Myotonic dystrophy shows anticipation due to repeat expansion of which trinucleotide? CTG repeat in DMPK gene. Lambert-Eaton myasthenic syndrome antibodies target which presynaptic channel? P-Q-type voltage-gated calcium channels. Posterior inferior cerebellar artery stroke produces ipsilateral Horner syndrome and contralateral loss of pain temp. Syndrome name? Lateral medullary Wallenberg syndrome. Antiepileptics safe in liver failure because renal elimination and minimal protein binding. Levetiracetam. Frontal lobe seizure hallmark motor event observed as fencing posture called Jacksonian march, though that's primary motor cortex. Except, fencing posture is asymmetric tonic seizure, FLE. Best initial screening test for peripheral neuropathy in diabetic clinic? 10 grams monofilament test at plantar surface. First-line therapy for restless leg syndrome refractory to iron correction. Pramipexole, dopamine agonist. CSF opening pressure greater than 250 mm H2O with normal constituents in obese woman with papilledema suggests idiopathic intracranial hypertension. Pseudobulbar affect treatment drug combining dextromethorphan with quinidine. Most common intracranial tumor overall, including secondary metastases from lung, breast, etc. First-line IV antibiotic for brain abscess of autogenic origin, mixed flora. Ceftriaxone plus metronidazole. Open ring enhancement on MRI suggests demyelinating lesion rather than neoplasm, hallmark of tumefactive multiple sclerosis. Spinal shock initial phase shows flaccid paralysis, bulbar cavernosus reflex return marks, end of spinal shock and beginning of reflex phase. Acoustic neuroma arises from Schwann cells of which part of 8 nerve? Superior vestibular division. Anosmia with bitemporal hemianopia localizes tumor to olfactory groove meningioma extending to optic chiasm. Cerebrotendinous xanthomatosis has elevated serum acid. Chenodeoxycholic acid deficiency. Elevated cholesterol. Osteoreversible encephalopathy syndrome, PRES, classical MRI finding, vasogenic edema in parieto-occipital white matter. Basilar migraine aura commonly includes mute brainstem symptom, vertigo, dysarthria, or diplopia, any one. Speak prosody rate 120%. Agent used to reverse neuromuscular blockade of rocuronium via encapsulation. Sagamodex. In the voice. In Duchenne muscular dystrophy, absent protein on immunohistochemistry is dystrophin. Most sensitive modality to detect acute diffuse axonal injury. MRI brain with susceptibility weighted imaging. Stroke mimic characterized by Todd paralysis actually represents transient weakness following focal seizure. Early decompressive hemicraniectomy for malignant MCA infarct is recommended within hours of stroke onset. Within 48 hours,